So we're in the X-ray room. I'm about to show you guys scans and labs from this female patient that came into our office struggling with autoimmune disease, and she wanted to get to the root causes of this because her doctors were only giving her antidepressants and more medications, and she wasn't feeling any better. She has rheumatoid arthritis, fibromyalgia, obviously she has joint pains, fatigue like crazy every single day. She has sleepless nights, she has an issue falling asleep and staying asleep. She's got some digestive system issues. These are her biggest complaints because she has diarrhea over the last 2 months before she came in and saw us. She's got bloating, she's got some skin issues. She also has some hormonal things going on, and the only thing doctors gave her was more birth control. And she has constant infections, UTI. She's been on so many antibiotics, and she wanted to just finally get to the bottom of this. So check out what we found. So what we do, of course, first is to assess not only the spine and the nervous system, but we're looking at all these other organ systems in her digestive system, because we're seeing that her stomach is definitely swollen and enlarged. But the bigger problem is she's holding all of this gas, indigestion, bloating, inflammation in her belly that shouldn't be there. It should look like this gray bubble here, and she's loaded with all of these areas that we need to investigate further. And with a lot of our fibromyalgia patients, and same with her, we're seeing this loss of curvature, which is really putting a lot of pressure on her spinal cord here, making it so she's not getting enough nervous system function and blood flow all the way downstream, even to the GI. Now, this patient's gut health was so inflamed, she was responding to 30 different foods. This is the first test that we have to run for our autoimmune patients, and these were all contributing every single time she ate them to more indigestion, more joint pain. So she saw some awesome benefits from avoiding these. It's obviously overwhelming, but this isn't forever until we start healing her gut lining. And here we can confirm that her histamine response in her gut is very elevated. She's not digesting much of her foods, her proteins, her fats, which is a big problem for even hormone production, for good mental health, and all those things related. She was also very low on one of the most important beneficial bacteria, Akkermansia. And here we see she has 4 different bacterial overgrowths that are bullies to her immune system. She has all the forms of strep. No wonder why she was constantly getting UTIs and infections, and she has an yeast overgrowth that should not be there as well. Not only was this patient getting joint pains from her autoimmunity, but her estrogens were so low beyond birth control, which was making a further problem as well. And her stress response, her cortisol in the morning was just off the charts. It shouldn't be anywhere near 22, and it's at 31.4. Healing from autoimmunity is not easy, but this patient has been putting in such hard work. I am so proud of her because she's been doing so good on her nutrition, avoiding those foods. She's been taking in her herbs religiously. Some of the main ones that helped her the most was Romania, Boswellia, and many others. And she also got off of birth control, so her hormones are turning back online. She just feels so much more energy finally. She's having more regular bowel movements. She has way less joint pains. She also is getting adjusted regularly, making sure we're working on that neck curve, especially with fibromyalgia. And guys, if you have no health restoration plan set forward for your autoimmunity, make sure you're looking into tests like this. We're testing all of our patients to make sure we're saying, hey, what is my body responding to? Because everybody is different. Everybody has different needs, different deficiencies, and different levels of toxicities that need attention. If you need help and guidance, comment down below. We would love to see what your situation looks like.